Hi, I'm Dr. Tomoaki Kato, the Surgical Director of Liver and Intestinal Transplant Programs at New-York-Presbyterian Morgan Stanley Children's Hospital. I'm a transplant surgeon. I do transplantation in children, particularly liver and small bowel. Well, I started off as an adult surgeon. I did a lot of transplant in adults. But a pediatric is always part of the program I was trained. You know, transplant surgery is still a very special field. So it's not that you can be trained to be a pediatric and transplant surgery at the same time. So the most surgeon does pediatric transplant comes from the adult transplant. So I started to do children a few years after I started my career as a transplant surgeon, and I loved it. In addition to general organ transplant, we also offer very wide range of advanced hepatobiliary surgery on children. We do a lot of liver resections, pancreas resection, and also the surgery called shunt surgery to bypass when the vein is clotted, to bypass that area. These shunt surgeries are also a large volume has been done here. One other very unique surgery I personally do myself is ex vivo surgery. This is to take the organ and tumor out and then cut the tumor outside of the body and put the organ back in. With this very unique expertise, we have been able to remove the tumors that cannot be removed elsewhere. In Morgan Stanley Children's Hospital, we have many different discipline expertise form a team to treat the transplant patient, because transplant is really a lot of many different aspects. It's not just the surgery, because after surgery you have to take medicine, you have to follow up with the medicine. There's a lot of social support may need it. So we have a team of expertise of gastroenterologist, hepatologist who is just specifically trained to do transplant, surgeon, expert in pediatric transplant, social worker, dietitian, psychologist, child life specialist, physical therapist. All of these experts form a team.